episode is brought to you by Promensal.
We need to have integrated medicine and, supportive care. Gut microbiome, mood disorders, insulin resistance, they're all linked to hormonal shifts. So I really push for integrated clinics where we've got those primary care physicians, endocrinologists, dietitians, psychologists, all of them working together. Like, how great would that be to be able to have those accessible to the general public?
Welcome to Thriving in Menopause, brought to you by Prevention Australia. I'm Zoe Meunier, the editor of Prevention, and in today's episode, we're peeking into the future because the way we approach menopause is changing fast. Thanks to growing awareness, better science, and a wave of women speaking up, menopause is finally stepping out of the shadows. But we still have a long way to go, especially when it comes to treatment access, personalisation, and healthcare that truly meets women where they're at. Joining me today to explore what's next is Dr Dev Ameratunga, a leading endocrinologist with a special interest in women's hormonal health. Dr Dev is passionate about reshaping how we understand and support women through this life stage, and I'm thrilled to have her with us.
Thank you for having me, Zoe.
Dr Dev, let's start with where we are at right now. As an endocrinologist working on the front line of hormonal health, how would you describe the current state of menopause care in Australia?
So I'm theoretically a reproductive endocrinologist. So I do deal with these issues quite a lot. And I think we're getting better, to be honest. There's more awareness, there's more training for health professionals, and women are just demanding better care. But as you know, access is still quite patchy. Too many women are dismissed or undertreated, and especially in areas where there isn't as much education, like rural or public health. So I think certainly we are opening the doors and, we are looking at menopause care in a better way, but we still have a little bit more to go.
Yes, absolutely. And where do you think that really needs to change in terms of awareness or education, as you said, in those rural areas, just getting the information and care out there?
Well, I think we need to move from conversation to action, to be honest. And that starts at the grassroots. Women are talking about this loudly and publicly, which is fantastic. And I guess the thing that's really changed is we are an aging population. And, it's estimated by, I think it's 2025, that more than 1 billion women will be in menopause. Social media, celebrities, podcasts like this, workplace advocacy, all of those things are normalizing the conversation, but we need to have quite a planned way to get that education across. And that means from schools to, knowing about your reproductive health and the transitions that occur naturally, to the healthcare professionals, starting from basic training right through to specialized training. And that's just in those areas, but the workplace needs to reflect that as well. So the policies and, the leave that patients can get, as well as the government policies and, affordability for care. So it's kind of multifactorial and it needs to go across the age span.
Absolutely. So when we're talking more about the future, we're hearing a lot about personalised medicine in menopause. So can you break down what that actually means in practice and how personalised can care really get?
I guess it mainly means that it's not one size fits all. We look at your symptoms, your personal health risks, lifestyle, and sometimes even genetics to tailor treatment, whether that's hormones or lifestyle changes or non-hormonal therapy. And often it's a combination of all of those things. So just to give you an example, there are women who go through menopause at a very young age. You may have heard of premature ovarian insufficiency, and there are genetic implications for this. And so the way I treat someone who's 15 going through menopause is vastly different from someone going through, say, a natural menopause at the age of 48. So that's an extreme example, but within those age groups, there are nuances that really should be taken into account for in order to manage someone properly and effectively.
Absolutely. And obviously that does need a lot of education, as you said, from the practitioner. Now, let's talk hormone therapy. We're hearing a lot about bioidentical therapy. Can you talk about the difference between that and synthetics and what that means for women?
Yeah, so bioidentical is really as close as possible to the natural hormones that we can get, whereas synthetics are what it says, synthetically made. Bioidentical hormones is really kind of where we're getting at. The reason that they're good is that we kind of know dosages. We can figure out, studies have been done in terms of output versus input, and the synthetic ones are not as identical to the body, so may have other effects that we're not wanting. So, for example, cancer risk. As an example, the natural hormones that we can get, obviously, everyone just assumes natural is the best, but natural hormones are harder to extract, and the natural way we get things are not as strictly controlled. So, I think bioidentical hormones are the way that we are going to go through in terms of the hormonal therapy. These regulated and standardized hormones are already quite mainstream, and the best kind of way that we run it in order to reduce those other risks like breast cancer and things like that have been in the media. There are also compounded kind of custom bioidenticals that people often access. These aren't well studied, so you've got to be quite cautious with these because we don't quite know the dosages and outputs. So as a general rule, I don't tend to use those. And traditional HRT, absolutely has a place for some people. But hormones are just one of the tools that we can use. And if you use it in the correct way for the right person, it's a very safe and effective treatment for many women.
So in terms of hormone therapy, are there any also, when we're looking to the future, are there any exciting developments in how they might be delivered? So things like gels, patches, implants that we have at the moment, or are there any new options out there that could make treatment more effective or accessible?
Yeah, so because we're talking about it a lot, people who are going through menopause and who have symptoms know that there's been quite a shortage of supply of some of our, treatment modalities. And this has been a big issue for us. And certainly we've been lobbying governments as a society to try and get us more access. And that's been quite successful. It's funny, some of the older kind of implants and things, they're actually quite old and they're kind of coming in a little bit more as well. It just gives you a longer treatment, a supply, I suppose, than putting on gels and so forth and patches. But really, we know that the topical hormones, especially estrogen, are a more effective and safer way than the tablet form. So for the moment, we are going towards the more topical, whether it's gels or patches. Now, one of the exciting and new things that are already being used at the moment is the non-hormonal treatments. So you may have heard of the neurokinin 3 inhibitors. We're actually using them a little bit more now, and they're an excellent new therapy that really takes away the risk factors of hormones for some women who can't take hormones. So I think there are a lot of things being developed, and the more we learn about what menopause is about, we're actually able to come up with newer, when I say we, not me, the really clever people that make these medications, as other options for patients, especially who are potentially high risk for hormones. So maybe not particularly the modality, but the different types of treatments are certainly the way of the future.
For sure. So as an endocrinologist, what do you wish more GPs and even women themselves knew about the wide-ranging hormonal shifts that happen during menopause?
Look, I mean, I work with really some amazing GPs, to be honest. We work together, and I find that this is the key, the way that we manage hormones in patients needs to be multimodal and understood by everyone in their care. I tend to deal with the more complex and tricky patients, but the primary care physicians is really where it's at. That's where patients can access, all of these treatments. And I think GPs are educating themselves quite a bit. And if they're not comfortable, referring on is a really important thing. I think everyone needs to know that there's the basic hormonal shifts that happen and the variability in individuals, like I said, to individualize those care and not to just push through. I personally feel that early menopause really needs to be looked at quite urgently because there are really important things to make sure that, we protect a patient's bone and heart and brain health. And I wish, I suppose, that people get a bit more comfortable with using the treatments and the treatment modalities like menopausal hormonal therapy or HRT, and to really take away that fear of it that has been falsely kind of given, unfortunately, due to some data a while ago.
Yes, absolutely.
Hot flushes? No sweat. Try Promensal Menopause products to relieve common menopausal symptoms for both perimenopausal and postmenopausal women. Promensal understands that hot flushes and night sweats are not the only things going on in your life. This is why Promensal has added 2 new products to their range. New Promensal Libido and Energy, because face it, we all could do with a boost of both. And new Promensal Brain Fog to help increase short-term memory, mental recall, and reduce cognitive fatigue. Now, where did I put my keys? Promensal provides premium holistic supplement care for women using evidence-based ingredients for products you can trust. Promensal is here to help you take control of your own health and live your best life. Plus, check out our brand new look in-store now. Always read the label and follow directions for use.
Yeah, so let's go back to where you were talking about how declining hormone levels impact other areas like brain health, heart health, even longevity. Are we seeing, I guess, a change in the way that we treat patients based on that more holistic understanding of what menopause means to the body?
Absolutely. And I think it's scary, isn't it, to think that 100 years ago we were, I don't know about you, but I was certainly supposed to be dead by this age. And it's just that more and more of us, thanks to medical advantage, modern medicine, we are living to a greater age. And that means that all of our other bodily functions are also surpassing that age. And there's a reason why estrogen in our, reproductive years is important for not just symptoms, but for all of those aspects, whether it's brain, bone, gut health. So really, when you're looking at menopause, you need to look at all of that. And most of us know the risks of not having estrogen in all of those areas. So yes, it should be looked at. We need to have integrated medicine and, supportive care. Gut microbiome, mood disorders, insulin resistance, they're all linked to hormonal shifts. So I really push for integrated clinics where we've got those primary care physicians, reproductive endocrinologist or pure endocrinologist, dietitians, psychologists, all of them kind of working together. Like, how great would that be to be able to have those accessible to the general public? And some great public places actually do have that down in Victoria, and there's in Sydney as well, but it's few and far between.
Absolutely. I mean, let's talk about accessibility because, future forward treatments are great, but, how do we ensure that they're not just for the privileged few? What would equitable menopause care look like in an ideal world for you?
Well, I think it again comes down to government, doesn't it? Look, we, and it's great that women are having a voice because that's what makes the difference to policy and funding. It doesn't matter how much we say. It makes no difference. But I have a lot to do with politics. I hope the politicians aren't listening. But, it's the patients and the people who vote that makes a difference. We need Medicare rebates, for longer consultations, GP education, public hospital menopause clinics. Workplaces are slowly getting on board, some better than others, so workplace health, digital health, they're all going to come through a little bit more as well. And, just to bridge that gap for women who can't see specialists. And, Australia is one of those places that it's very tricky, in the rural and remote areas to get access. But the great thing is telehealth and digital apps and things should be accessible to most people. So we just need a little bit more input and funding for those aspects as well.
Yeah. So looking at technology, digital things, what role do you see for digital tools, things like symptom tracking apps, wearables, those kind of things? I mean, you've mentioned telehealth, of course, in helping women navigate menopause better.
Well, I think it plays a big role. I mean, my main area that I deal with is infertility, and in the fertility world, lots of people use apps, all kinds of things. But we can translate that to the menopause transition as well. Wearable, things. I'm sure maybe you use them too. You can track your sleep. If we can have things that track hot flushes, because a lot of these apps can track temperature, heart rate changes, and all of this can give us real-time data. And apps and telehealth make these, like I said, accessible to rural and busy women, even if they're not rural. But the thing with apps and so forth is they do need to be somewhat tested and evidence-based, because there's a billion things out there. It's like the web. You can see that even in the social media and online, you've got to be quite careful to figure out who actually is talking evidence-based and, from experience and knowledge rather than gimmicky kind of information. So it's quite tricky.
It is tricky because there's just so much out there, isn't there? It's quite overwhelming to navigate it all. And where do you think menopause care will be in say 10 years' time? Like, what are you most excited about looking to the future?
I think you've touched on quite a few, Zoe. I think that, the precision medicine I'm quite excited about. I think the genetics that we're knowing and figuring out, and the biomarkers and personalized risk factors are really exciting, and it'll really help us tailor therapy. I'm looking forward to the novel treatments that are even more non-hormonal, and addressing the mix between genetic and environmental factors. And hopefully, if we can get this sorted in a way, menopause care will be part of just routine care and not a taboo or, an afterthought or, something that we have to lobby for.
Yeah, absolutely. So can we just go back to some of those novel non-hormonal ways and just discuss those in a little bit more detail?
Yeah, so we I guess it goes back to physiology, and just one of the examples, like the, neurokinin 3 inhibitors, for example. We know that, for a long time we're not quite sure how even hot flushes, for example, occur. We have all these theories that it's a change in set point. Estrogen potentially changes, the temperature regulation. There's lots of theories, and now we know probably there's an integrated kind of area in our brain that takes all these inputs from different nerves and hormones, and then has something to do with the temperature regulation. And we know that one of those aspects can be interleukin, and it's not a hormone, but it's more like a nerve center. And we know vasomotor symptoms, so hot flushes, night sweats and things, can be quite associated with this. So, just trying to address that rather than the output, which is replacing the estrogen that's lost. We're trying to go more centrally to nerve and neuromodulators and things like that to try and affect symptoms rather than just replacing what is lost. But at the moment, that's only for vasomotor symptoms, so for hot flushes and stuff. And we know menopause is much more than just that. So, we're slowly getting there, but it's just nice to see that we're looking at other aspects.
Oh, well, finally, if there's one message you wish every woman in midlife could hear about her hormonal health, what would that be?
One message. I might give a few.
Sure. Some messages that,
Well, I guess that you don't have to just put up with it. Menopause is a chance to look at your health as a whole. Ask the questions, get informed, and don't be afraid to seek the help. And be aware acutely of medical misinformation. Everyone and anyone gets on YouTube, Instagram, and so forth. So you do need to do your own, and you're in charge of your own health. So to take that, this is a bit of an unusual age. I think we've lost faith in the medical system for good reasons as well. But I think there are good people out there. There are people who know what they're doing and trying to give a voice to this very important issue. So I think word yourself up and look after your health, empower yourself to be the person who's in charge of that.
Absolutely. Well, thank you so much, Dr. Dev, for such an insightful and future-focused conversation. It's exciting to know that better, more personalised menopause care isn't possible, but it's already starting to happen. So that's fantastic. Really enjoyed having you here today.
Thank you so much for having me, Zoe.
And to our listeners, if this episode sparked questions, ideas, or a sense of hope, that's exactly what we aim for here at Thriving in Menopause. So be sure to follow or subscribe so you don't miss what's next. I'm Zoe Meunier. Until next time, stay informed, stay empowered, and take good care. And a great way to do that is by picking up a copy of Prevention magazine. See you for our next series in October.